next few months. And our group is very, very excited to host you today, please. And thank you for joining us. So my name is Amali De Silva Mitchell. This session format, I'll just first give a quick introduction. There'll be 2 presentations, and then there will be a bit in the middle, which we are calling the mosaic. And that will be impressions from some members of our dynamic coalition. And we hope some invited guests will also be able to reach us. But at the moment, due to COVID, we have 2 of our members either very busy in hospital administration doing that, or due to very sudden lockdowns in the area they're in their country, they cannot reach us through technology to be with us. So we will have to play it by ear and deal with that at that point in time. Okay, so our group has a focus on issues, risks, benefits, and opportunities for the end users of the full value chain for healthcare and associated activities. So that's a focus of our work. Okay, and that will come alive through Mosaic, through our presentations, and right at the end in a discussion with all of you. Okay, so we'll kind of break this down into a couple of segments, sort of 30 minutes each. That's kind of how we planned this out. And so I just want to say that all of this information and all these discussions, we're going to bring this into a paper, which is going to be our very first paper on technology values for healthcare. Okay, so we're looking at services within the healthcare industry. We're looking at actual technologies. We're looking at the manufacture of drugs, the whole full sphere of healthcare services, products, and so forth. Okay, so we're going to start on this project, and then we will keep updating it each year. With as we get more information from all of you, and that's how we are proposing to move forward with our DC. Now, our DC also has 2 educational components that we'll have today on blockchain and machine learning. That's 2 of 4 papers or presentations that we have said that we will be producing for this dynamic coalition. Okay, so it should be very, very interesting. We also are going to be having a survey in 2021 and also a poster competition in 2021. And the announcement of those activities will be posted to the announcement areas of the website, the IGF website. Okay, so please, I'd like to also invite all of you to participate with us in this very new dynamic coalition and sign up to our list. The email address is also found under dynamic coalitions, and currently we are placed number 7 on the list there, so you can find us there, please. Now, I am just going to give a little bit about who I am, and then we will start the session. So I'm British Sri Lankan. I have worked in the technology industry, software, hardware. I was also president of an internet service provider in Canada called the Vancouver Community Network, a nonprofit, also director of Freedom of Information and Privacy Association of British Columbia. I've also worked in the government sector in hardware and software development. I am an accountant and an economist, but I also have some background in computer science. So that's a little bit about myself. And I'm going to ask each speaker before they speak, just to tell us where they're from, and then a little bit about themselves, and then please to then start their conversation with us, either through a presentation or impressions or so forth. Okay, so our very first speaker is Galia, and she's a founding member of our group here. Galia, you have the floor, please.
Thank you, Amali, and I'm really happy to take part in this exciting work. I am Bulgarian by origin, and I have a international background, exactly as you do. I have a bachelor in economics, master in political science, and a PhD in economics. And I had the privilege to live in not only in Bulgaria, but also in Germany, work in the US at the World Bank for 8 years. And now I work and do research at the University of Applied Sciences in Switzerland, in Basel. So it's really exciting to talk about such a most pertinent theme, and I'm really looking forward to the discussion today.
Thank you, thank you. So you are our first speaker, Alia.
Yes, I have prepared some slides, and I would like now to share this with you. Hopefully now you can see my screen.
Yes, thank you.
Okay, so the topic on which I would like to talk to you is the application of blockchain in e-health records. And this is a very important topic because now we are looking in many countries for solutions of how the patient should have control over their own data. And blockchain seems to offer some acceptable technological solutions for providing the patient with control, so-called sovereign control over their data, and disclose it only to the extent that is necessary. And I would like first to start with a very brief introduction on the most important characteristic of the technology blockchain. So what is so different when we talk about blockchain as compared to other technologies? Well, first, as you could see here, we talk about decentralization, which means the patient or the health institution does not need to have a central place to store this data, but the storage of the data could take place in a decentralized manner on a ledger that is managed and to which there are different parties that have access to. And this is something quite new as a concept as compared to the silo data models where we have the data centered in one specific database. Then we have the other three categories of the blockchain technology, namely persistency, anonymity, and auditability. And this has to do with the fact that all the participants in a certain blockchain have access to the stored data. And the data that is stored there can also be tracked back. And in this case, we can say that there is a auditability and persistency of the data. Persistency of the data also means that the information available on the different distributed ledgers is the same. It cannot be changed by any specific actor or the so-called nodes on the blockchain. Then we have another very interesting characteristic. This is anonymity. And this has to do with the cryptography that is being applied for storing this data on the blockchain. And here, concerning anonymity, of course, are the big challenges related to the technology and all the regulations that affect health data, in particular also the privacy, data privacy aspects, and in Europe we have the general data protection regulation. And that's why here this factor anonymity is very, very important to be analyzed when we talk about the application of blockchain in e-health. And I, in this presentation, have spent some more time, particular time, on looking into the security aspects also of using a blockchain for e-health data, because the cybersecurity issues are another important topic, especially now in the last months, when we hear and read different articles about the leakage of data. So this is a very important aspect related to the blockchain technology. Here, an overview of the different possible blockchain applications. And now we have many good use cases that provide examples for these applications. And as you could see here, this is just a number of the blockchain applications that now we experience. So it started with finance, of course, the cryptocurrency application use cases, but then it moved also quickly to the Internet of Things applications. Then we have also possibility for blockchain in the energy sector. These are the peer-to-peer blockchain trading platforms that are now being under discussion in many countries. Then we have, of course, the public sector blockchain applications. And especially now in Europe, there is a big project of developing even a European blockchain infrastructure, services infrastructure, considering the demand of having cross-border efficient flows of information and the data. And here we have the healthcare industry, and this is exactly what our coalition is looking into, healthcare and e-health applications. So let's move slowly to the health sector. And here I would like to focus on the electronic health records. As I said, there are legislations. I can just mention here the Switzerland, where I live, and the project related to the introduction of electronic patient records. And this concept of electronic health records integrates an individual's medical health records generated by a health service provider, such as a physician, a medical assistant, or a pharmacist, and private health records generated by the individual. So it means here we talk about not only the private health records, but also any additional information that could be generated and added by health service providers. Now, what is the requirement about the electronic health records? They should allow the sharing of data between authorized providers and an individual, but in a data protective manner. And here, because of this sharing of this information, blockchain comes into the picture and provides some technological solutions, but as I said, it's a work in progress, and there are many aspects that need to be looked at. Now, here in detail, some data health records data types we are talking in particular. Well, here it's when we talk about health data, we talk about different allergies, also, but the demographic statistics, like what is the patient age, where does this patient live, documents like attached files, photos, X-ray photos, or some other documentation. Then we have the evolution, the progress and clinical notes, care plan available for this patient, any family history, well, what is are there some known diseases and related to family members, then general information, emergency contact, then we have the genetic information, any home monitor data, immunizations, insurance, laboratory results, major illnesses, medication, prescriptions, prevention, and so on. And here, as you could see, when we talk about electronic health records, basically this is a comprehensive set of all the information associated with the patient and the track record of any diseases, but also of any treatments. And now I would like to come to my last slide, and namely, I have here prepared one slide that provides an overview of the coverage of cybersecurity relevant requirements for these electronic health records by blockchain. If we would like to apply a blockchain, like for example, I have taken the Hyperledger Sawtooth here, and there is an analysis, preliminary analysis that has been conducted in the sense of to what percent does a blockchain cover the cybersecurity relevant requirements for electronic health records. And here you could see the dark blue bars are presenting these requirements or categories to which blockchain accommodates best. And here we could see availability. So this is the accessibility of the data, and also integrity also has with an 88% here coverage, which means integrity is the fact that the data cannot be amended or altered changed once on the blockchain. But as you could see here, the blockchain applications are not so well in reality, security, and also here I should say the GDPR requirements, of course, of the possibility to of a patient to delete completely some of the information comes into discussion. So with this last slide, I just wanted to provide an overview that blockchain as a technology provides potential for the coverage of a cybersecurity relevant requirements for e-health records. However, there are some aspects which are still open, and I assume that the brilliant technologies would have a solution if we would like to think of a serious implementation of this technology for the e-health records. So at this stage, I would like, of course, to thank you for your attention. Here you see also my contact data, and most of all, I look forward to a lively discussion on these issues.
Okay, thank you very much, Alia. That's very, very informative. You know, for yourself as well, it's really interesting to see all those data types and the integrity and so forth. And yes, we'll keep, please, audience, we'll keep the questions right to the very end after all the speakers have spoken. Okay, so thank you. And please, we are now going to move on to this section called Mosaic. And I am not sure who's actually with us. So I am just going to call out names and hope that we have people we were expecting to have. Yao, are you with us, please? Okay, we don't have Yao. Yao was going to talk about language, because in this DC, we are particularly also interested in the access to e-health. And he was going to talk about the importance of translation, and so forth, so that we can increase access globally. Okay, so that was what he was talking about. Very important value for us. And we'll hopefully, I'm not sure if he'll join us later. We'll come back to him. Do we have Mrs. Lakmini Shah? Okay, we don't. She was an invited guest. She's a councillor at the city. It's a borough of Newham in London, in the UK. And she was going to talk a little bit about smart cities, but she did email me and say that she was not well. So that's probably what that is. We had also Dr. Pramila Senanayake, who is retired Secretary General of the Family Planning Association, Federation internationally. And she is, unfortunately, due to restrictions of lockdown, suddenly unable to reach technology. So we have that. We have also Jana Bellot, who is going to be speaking, senior hospital administrator in the US, and she just told me a few minutes ago she has to rush off to deal with some issues there for COVID and so forth, which she's covering. So I'm beginning to think, Herman, are you available, please?
Hello.
Hello, Herman. Yeah, I think please, if you can take the floor, that would be great.
Okay, thank you.
And please, you have your full time, as there are so many of the music are unavailable due to COVID and other related. Yeah.
Okay, thank you, thank you. I'll just start to share my screen. Oh, excuse me. Oh,
No worries, take your time.
okay. Can you see?
Yes, please, we can see. Yes.
Okay, thank you. My name is Herman Ramos from Mozambique. I have a background in physics, and I've been working with technological innovation at Inagloba and at Mos Italy here in Mozambique. I'm also the 2020, one of the 2020 Internet Society Youth Ambassador. So I will just start my presentation. Oh, so as starting, the development of internet information and communication technology has been contributing to the digitalization of many activities and sectors, and health is no an exception. The advancement in portable communication technology and digital computing have improved the speed and efficiency in which data can be processed and exchanged. Due to the unprecedented spread of mobile technology, as well as advance in the innovative application, tens of millions of citizens and people now use mobile device as daily tools to communication and data transfer. MHealth have been used to address a high range of challenge in areas such as disease surveillance and health system and health education. Basically, we define ML or mobile health as a mobile computing or medical sensor and communication technology for health. And have been we have been noticed the increase on mobile application solutions because they can address high numbers of different health issues. Also, mobile health allows or offers the ability to remote individuals to participate in healthcare. Basically, individuals can be in communities. They don't need to go to healthcare facilities. At their home, they can have early diagnosis and can monitor any kind of diseases. Basically, most common application of mobile healthcare is use mobile phones and communication device to educate consumers about preventive uh, healthcare service. However, mHealth has a high range of application. We can see here, if we integrate the diagnostic and monitoring systems, this can offer an effective surveillance and control measures to limit the spread of any kind of infections. We are talking about disease or etc. Basically, this offers two types of benefits. First of all, is the increasing the access to healthcare outside the care settings. This is why I was talking earlier. We don't need to go to a formal healthcare facility. You can do the self-testing at home. The second is that after making the test, you can have the diagnostic results that is important for you and the healthcare professionals that will elicit the rapid and appropriate clinical and public health response to the kind of epidemic potential. In this way, we can see that diagnosis and monitoring of disease are key to clinical management. Here we have a table basically that divides all the steps: diagnosis, basal community or self-testing. It allows what kind of opportunity that gives early detection, automated results, capture, and analysis. Treatment and patient management. There is a linkage here between the results, or when the patient have the results, there is a linkage here to the clinical care, because the clinical care has a connection with the mobile. Also, we have the disease control and elimination. After we have the results of the diagnosis, we can apply the epidemic control. In this way, public health can implement control strategies to monitor and control diseases. The, the application of mobile healthcare is not only for developed countries. This is also applicable for developing countries. We know that the health infrastructure in developing countries is much smaller than in developed countries, and access to medication is limited, especially in rural and remote areas. Therefore, the application of we can now apply a cheap mobile healthcare and machine learning to provide or create an efficient and early diagnosis of most common diseases, including the warning for epidemics. As sorry, as many areas related to internet, the mobile healthcare also has some challenge. One of the challenge is regulation. In this way, to address this challenge of regulation, is important to develop a regulatory framework that consider the wide array of medical apps that are emerging because we can see that regulatory are not keeping the pace with the technological innovation. Also, the cost and clinical effectiveness. In order to guarantee a best integration of this kind of system, it's important to have, or is required to have evidence and its clinical effectiveness and resulting cost effectiveness. One of the many challenge, or the most important, I can say the most important challenge, is the digital divide, because we know that in many countries, many people don't have access to internet. And then if they don't have access to internet, there is no possibility of enjoying the benefits of mobile healthcare. In this way, it's important to ensure that no one is left behind. Conclusion: investigations in modern physics sparked the technological development of health system, which with the design of various equipment and diagnostic techniques. Now it's time for the internet, information and communication technology to create a digital revolution in the health system. Thank you.
Thank you very much. So I think contact information is there, and people can contact you. Is that?
Yeah, I'm open to any kind of interaction and engagement.
Okay,
And
excellent.
also
So
we have our mailing list at the Dynamic Coalition.
yes, thank you for mentioning that as well. So that was a very interesting presentation, and again, we will please, audience, keep our questions right to the very end. I am just going to ask the Mosaic speakers, do we have any others, please, with us? Is there anyone of the Mosaic speakers with us, please? Okay, I don't think anyone made it. We have a number of medical people with us. They are obviously very busy with COVID and so forth. So, Jan, would you be able to bring your presentation forward, please?
Sure. Just let me start it and share screen.
Excellent, thank you.
Okay, so now I have to.
And Jan, you have your time.
Yes. Okay, so please allow me to take a little bit of a larger angle, and I would like to take a look at AI. And while it is a very promising technology, it is often also misunderstood. And and I would like to therefore focus a little bit how it works. So my name is Jan Erbgut. I'm head of technology insights at Geneva Microlabs, a do tank in Geneva. My background is in law and technology, so I'm not a health expert. And I also teach at the University of St. Gallen, the University of Lucerne, and the Geneva School of Diplomacy. I would like to talk about how AI works and why I think the power of AI is currently overestimated and a better understanding is needed. So let's start with some myths about AI. You remember Brexit, and although Brexit is quite well, I'm not happy at all about Brexit happening, but I don't think it has been caused by any kind of bots or Cambridge Analytica. And actually, there has been an inquiry, and the information commissioner said, well, they found no evidence. So of course, Cambridge Analytica, they broke privacy laws. So they are not a good company, but they also lied about their capabilities. They did not have the power to influence public opinion in that way. So it's we must not be too afraid about technology because we don't understand it, and often those powers and those risks are both overestimated. Another example, maybe you heard about Twitter social bots that spread fake information about COVID-19 and about any other topic as well. The good message is they don't exist. The bad message, it's people. And actually, There are some publications that are being cited. There are some papers that cite those people, but actually there has not been an evidence of a single social bot. I mean, there are bots there that automatically post content, like from publishers. There's a Big Ben bot that posts the time. So this exists, but a social bot that behaves like a human, that cannot be distinguished from a human and is actively pushing a specific agenda, has not been identified at all. So people claiming that 50% of the accounts involved in a certain discussion are bots, they should at least be able to identify a single one. And there has been a researcher, Florian Galvans-Wilz, and he is asking every single publication about those social bots, please name me the accounts. I will check them, and he's checking them, and he did not find any of those accounts that were not human. So, of course, the good message is there are no social bots. The bad message is it's humans that post those nonsense. Okay, the third one to describe how we treat AI is the cropping of images by Twitter. When you post an image, a tweet with an image on Twitter, you have to, well, you can add any kind of and size of image to your tweet. And if the format, the aspect ratio of your image does not fit the preview of Twitter, they crop it, meaning they cut it and they select the most probably interesting part of the image. And the most interesting part of an image is usually a face. So they select a face, which works pretty well. The trouble starts when there are two faces on the opposite ends of a face, of a picture. So then they have to select which face to take. And of course, then they can only take one face. So there will be a decision. And sometimes it's an easy decision. If you have a big one in the foreground and a small one in the background, then it's obvious. But if they are pretty similar, and of course we know one person is more important than the other one, but the system doesn't know that. And the system selects the same face regardless where it is in this picture. So this is not proof that there is some general preference to a skin color. And actually there has been a test with 90 pictures, which is not too big, but which is reasonably large, and which has shown that there has not been a specific preference for a skin color. But of course, those systems, they don't behave according to rules. So we don't trust them, and we expect the worst. So this is kind of symptomatic how we deal with this kind of technology, because it is there, even in a context where it doesn't really matter. Nothing of the image is lost. It's just a preview. So what the heck? But imagine these kind of things happen to the use of AI in health. And some group of people will be not treated equally. Then we have a scandal, and it will happen, and it happens because this technology does not go along with rules, and we have to either accept it or use a different technology. There is no way to stop AI from doing that because it's the basic essence of deep learning. But let's see, what is AI? when we look at computers playing chess, they can outperform even the world champions, the world chess masters. So is a computer that's playing chess AI? Well, your pocket calculator, they can outperform any human in multiplying numbers. So it's obvious they outperform human in a task that animals cannot do. So are they AI? No, we don't name them AI because they're too trivial to do so. It's like AI is only the cutting edge technology. Once the technology becomes commonplace, it's not AI anymore. So the definition is more, it's not a scientific definition. It's more like a common definition for some new technology. Alan Turing said, well, AI is when a human cannot distinguish another human from a computer. Okay, sounds reasonable. We have this in a little bit of different way. When a computer wants to know whether you are a human or you're a robot, they ask you to fill in a CAPTCHA where you have some writing that is distorted and you need to decipher it. And computers are getting better than humans in deciphering it. So a little bit of a varied Turing tests. Are computers now capable of AI? Well, actually, Google replaced the CAPTCHAs with some software that is spying on us to determine if we are just a robot taking content or if we are really human. So how does deep learning work? And in my view, deep learning works like a dog. You teach a dog. You if the dog behaves well, they get a positive reward. If not, they don't get it. And you present a lot of examples again and again and again. And that's exactly what you do with deep learning. And actually, deep learning is using neural nets that is done similarly to the brain. So this is, it's not a surprise that behavior is a bit similar. And you have to take this into account because deep learning is really different from other type of computing. So you cannot expect that it behaves according to rules, that it is programmed, that people know what that they created. No, that's not the way deep learning works. So how does it work? First, you get a neural net. A neural net. And the initial state of the neural net, it is random and it needs to be random. And basically, that's the random ingredient into deep learning. And that's the reason why deep learning is not statistic. Of course, it uses a lot of data. So it's a bit similar to statistic, but it's not statistic. If you do a statistical analysis of some data and you do it twice, 3 times, 4 times, 5 times, you always arrive at the same results. With deep learning, you always arrive at different systems. So besides the neural net, you need a lot of training data, and you need the training algorithm. And the training algorithm is basically tuning the neural net so it will fit the training data. So how does that work? You got some examples. I just put 3 examples. Of course, usually you have thousands or millions of examples. And of course, the random state of the system is quite a bit different. Now you calculate the differences and you tune the system in a way that it gets closer to those examples. And you do it again and again, and hopefully finally your system goes through the examples and gives the right answers to those examples. This is not really what you wanted to achieve, because you already stored your examples. But what you wanted to achieve is a generalization of the system. So you have examples like D and E that the system has not seen before, and then you check whether the generalization is good enough for those other examples, test data and validation data. So you split your training data into training, test, and validation data. So to summarize, deep learning, that training is based on data and random. And the system is based on generalization, which is the same as stereotyping. It does not need any rules, but it does not obey any rules either. And it's imitating intelligence. And you always have to be aware that if there are new inputs that the system hasn't seen before, the results are unpredictable. Of course, systems usually behave well, and there's a high probability that they will do it correctly, but even new trivial inputs might behave quite differently. It might produce unexpected result. So what can these kind of system achieve? Here we have a system that can distinguish criminals from non-criminals. Wow. Well, when you look closer, you can do so too. You see those people with the white color, nice CV photos. They are not the criminals. And those people who don't look so happy, they just have been arrested. And those photos from just being arrested, they look quite a little bit different than the photos on your CV. So the system can distinguish a photo of an arrest and the photo of a CV, but they cannot distinguish whether somebody is a criminal or not. And this is basically the issue. It will not use the right criteria. So if the criteria matters, you shouldn't use them. If the rule matters, use a system that obeys by the rule, plays by the rule. And it can be hacked. Here is a stop sign and a Google car. And you see the stop sign on the right-hand side. On the left-hand side, the stop sign has some patches on it. And those patches, they're not really big. But the system does not learn that a stop sign is an octagonal shape with an STOP in white letters. But the system just picks arbitrarily some points where the stop sign is different than, for example, a speed limit sign. And if you analyze the system and find out which spots those are, you just have to put stickers, patches on those spots, and you get a different result. It gets even worse. Here's a picture of a lifeboat that's reasonably well recognized. And if you add a little bit of noise to it, it becomes a Scotch Terrier with a very high probability. And there has been research that shows that it can be sufficient to even change 1 pixel of an image to get really substantially different results. So this is the kind of hacking. You don't need to invade the system. You just have to tune your input in a little bit, and you get a completely different result without being detected because the system does what it does, but produces completely different results. And there's discrimination, of course. That is often in the headlines. And sometimes it's due to gaps in training data. So if there is a case that has not been trained, then there's a high probability that the system will not behave correctly. So if you only have white faces in the training data, then the system might not correctly recognize people of color. So it is very important to have a well-balanced training set, and even more than well-balanced, because minorities need to have an equal stake there. So if you have a minority that is 1% or 0.1% of the population, and the system should work for them as well, it's not sufficient to just have one example out of 1,000 of this minority. So you have to balance your training data, but unfortunately, this is not enough. Even if you have balanced training data, which is of course unbalanced training data or biased training data is of course one of the main reasons for bias. And even if you don't have gaps in your training data, the selection of the criteria to recognize as a person or a situation is based on random. And it is based on machine-generated stereotypes. And even basing decisions on statistics is bad, because it means that you base the decision on one person on the behavior of people of his or her group before. And deep learning is worse because it's not statistics, it involves random as well. So to summarize here the pros and cons of deep learning, the pros is you do not need rules. So if you don't have rules, you can still use it. And there are some fields where you do not have rules. And in those areas, it can be reasonably well compared to human action. But if you have rules, use a system that can obey your rules. It still works reasonably well with less than perfect data. So if you have a little bit of contradicting data, the system can still perform reasonably well. Of course, the performance will deteriorate with bad data in your data set. And this is often a problem, but it will not break immediately. And if trained well, can in certain situations produce good results. And another thing is, maybe you heard about the Tesla that is drove into a truck. It can unpredictably fail in even trivial cases. In cases where we don't have any question what the right decision is, but since the criteria is arbitrary, then you cannot rely on it, and it can be easily hacked, as we have seen it. So what to do with this? Well, we see that you cannot trust those systems, so you call an expert group to develop trustworthy AI. And of course, they cannot change technology, so they provide some advice that might help in some situation, but not really. A lot of government bodies, oversight committees, UN and governments, etc. Today, the German Bundestag, the Enquete Commission just published their report. So a lot of commissions produce a lot of papers. but they cannot change the fundamentals. And there is a lack of transparency. People often say, well, this is a black box system, and if we could look into the black box, it would be fine. No. You can be glad that you cannot look in the black box, because what's in there is really bad. It's not rules like you think should be there. It's quite a lot of silly rules that, in their combination, produce good results. So you have good results. You have statistically good results, but with a rule set that you wouldn't accept at all. And well, if you have a case where you want to use this kind of system, it should be made completely accessible for tests and analysis. And if you do so, you can find those blind spots, those areas where they don't perform well. Of course, this will expose those systems, but transparency is always good for security. So if you can expose those issues, then you have a chance to fix them. And high-level descriptions as a means for transparency are not at all sufficient in dealing with those issues. But not to stay completely negative, AI can make a difference in health. For example, the cancer detection on radio images has a huge potential. So we have quite positive effects, especially in those areas where we don't have specific rules for humans, where only experience counts. And how many images can be seen in the life of a human radiologist, and how many images can be used for training an AI system. And because this number is much higher, the system that is in principle much less well developed might outperform the humans that only have a much smaller training set. So this is the reason why I think there are applications in public health, but you have to be aware of the limitations, and you should look for certain things. You should look for different kind of systems that are more rule-based and that are not just trained. So to resume, deep learning use in health, they can outperform other systems, especially when you look at radio images, radiographs. But they all produce blind spots. So even if you have a great system that can diagnose cancer, it will not diagnose cancer with the same quality for all people. So there will be certain groups where the system works less well. And of course, this is not new. You have doctors. A doctor that has never treated a child might not be able to detect some situation in a child as easily as a pediatrician that is doing this all the time. So you have to expect that those systems are not neutral, that they have blind spots, and that they fail in trivial situations. But at the same time, statistically, they perform quite well in a lot of situations. And you have to provide a setting where you can deal with it. So you shouldn't rely on those systems, because then you don't deal with these risks and issues. But of course, you can improve health by using those systems in a way where you show those kind of responsibility. And so you need to expect bias. It cannot be avoided. There are people out there saying, well, they remove the bias. They can remove certain small bits of bias, Sometimes they impose even more bias by removing bias because they impose opposite bias, which will not wipe out the bias, but will basically increase the bias. And you just don't know against whom the bias will be. So it might be some groups we look specifically at. It might be some completely different groups, but nobody deserves to be disadvantaged by bias. So we need to expect bias, and we need to be able to deal with it. And if we can't, we should not use those systems, but we need to have safeguards in place that will be able to deal with those cases that will sooner or later occur. And we have another issue. We have the issue of the training data. The training data, especially in the health area, is often personal data, highly sensitive personal data. And you need it to train the system, and you need it every time again when you retrain the system. And you can, in a limited way, but in some situations, you can extract part of the training data from the finished systems. So this, of course, is a special issue. You can kind of create synthetic training data. And this works, has been proven to work, but then you need more data, and you reduce the quality of the outcome. So you have to balance whether you really want to do that or not, or you have to well, see if you can justify this by the positive impact. And to be clear, bureaucracy does not save us. So if there are those side effects, some can be mitigated a little bit by some measures, but you will not remove them completely. And you have to deal with them. And saying, well, if you document every part in the development phase, of course, then you can maybe reduce some sources, but you will still not have a perfect system, because the system is based on stereotypes. It's not based on rules. Thank you. I'm looking forward to our discussion.
Thank you, John. Thank you very much for a very interesting presentation there. So I must thank all our three speakers. We've had, very different viewpoints on e-health. Very interesting, very new material. So I hope our audience really got engaged there. And so I'm not going to take, we probably have maybe 20 minutes, I think. So we don't have too many members in our audience. So why don't, I'm just wondering, please, the technical host, can you advise us how we can deal with questions, please?
Well, people just can use the Q&A, and you see the Q&A button below your screen. And when somebody puts a Q&A there, you can look at them and we can answer them.
Okay, that sounds like a good plan. So please, audience, please be welcome to type your question there. And if you want to ask a specific question, it can be Galia, Herman, or Jan. Please state their name at the beginning of your question. Otherwise, just if it's to any panelist, then please be open. Okay, I'm just going to start this off with something to all three of our panelists, and just wanting to ask about the role of judgment, because it's a very important quality, especially when we are dealing with new systems. Human judgment is critical in making a very good decision. And you know, how, and opening this to all three of our speakers, where do you think the technologies, and each of you spoke on three very different areas: blockchain, the mobile tech, and the artificial intelligence, machine learning. Where do you think we can quickly see the technology picking up to the human, please?
Well, I think it is always a human using the technology. It's not the technology running against the human. But of course, humans can use technology to replace other humans. And they always did that for decades,
Yeah.
centuries. And this will continue to be the case.
Yes, yes, this is always the case, right? Always see that I have an accounting background, and I see repetitive tasks being eliminated very quickly. The more higher decision level tasks being retained for a long time. However, I'm seeing there is sometimes, you know, we have something in accounting called dashboards, and I think this is something that was very much in healthcare. I'm not a healthcare accountant. We are missing our founder member there, Gianna, in that field. With us today, but I'm beginning to think that there's going to be a lot of this dashboard being used. We know, and that is of concern to patients. And Johan, as you said, you know, there can be all these sort of what I call Trojan data pockets, you know, that suddenly come up there and you know, cause a problem. And maybe if the tasks have been now sort of given to staff who don't have the very high sophistication of medical experience behind them and education, you know, there's a risk there for the patient, and that has always been something a little bit of concern from a patient perspective, and something we can also then probably apply to mobile tech, and we can also apply in terms of privacy and blockchain as well, these sort of hidden pockets of data which all of you all mentioned. Considering I don't really see some other question, I'd like to ask Herman. Herman, could you please tell us a little bit how you think we should manage? I know this is really a sudden question, Herman. How could we manage the sort of linguistic delivery through mobile tech, please?
Hello.
Hello?
Oh, yes, I think that we technology creators only focus, like to focus most on developer technology that don't see the problems of linguistics. But I think that if we have a project, in this case, a technology that we want to implement, there is a possibility of states, if states want to implement these kinds of technologies, of these kinds of projects, they must engage with. I believe that is when the multi-stakeholder model it's important, because we can have the engagement of many other organizations and stakeholders, in this case civil society, private sector, academia, technical community. And I believe if these kinds of organizations and stakeholders work together, it's possible to overcome any kind of issues.
Mm-hmm. Okay. Okay, thank you. Yeah, so very important that the multi-stakeholder approach, and that's very much what our dynamic coalition is trying to achieve, to bring together as many stakeholders as possible, so that we discuss, what are the values that we have in common that establishes trust. And we have from the Harvard University, he was Stephen Covey. He was their professor. I'm totally not up to date exactly on his status right now, but he has written a new book called The Speed of Trust, and basically he's talking about coming to a good understanding amongst stakeholders, and how that creation of trust and understanding can speed the creation of any of the business processes, whether it's delivery, whether it's the embracement of blockchain technology, artificial intelligence, and even the paper processes as well. So, this is something that we are also thinking about, and we're saying, okay, if we can have a set of common understandings that will launch us to speeding up the development of healthcare to access universal healthcare access. So we'd also want to work with the community networks and all the other associated technical and other functions, so that we can speed this up globally for everyone. Galia, I was just wondering, would you, because you right at the beginning, you're probably rushing on all of our behalves. Is there something else that you would perhaps like to add, please?
Yes, one topic that is of great interest to me is ethics, and ethics in using artificial intelligence, ethics in using technology, especially for e-health. And here, when we talk about, or when I talk about ethics, I consider some aspects like exactly the privacy, data privacy, the one aspect. And the second thing is about developing models, especially in artificial intelligence, using data, patient data, and coming up to some recommendations and suggestions, and how ethical, right, could such models be. Jorn was talking about these different artificial deep machine learning models. How trustworthy, how ethical are these suggestions driven by this technology, and to what extent should they be accepted, implemented, followed? This is something which I ask myself, the question which bothers me, and the question I'm asking myself for a while.
Exactly. Exactly. And I think that the whole area of ethics runs through all of us, the stakeholders, and it's a very important topic in terms of where do we have commonalities, and definitely what are medical ethics, or what are the ethics of the administrators, especially the ethics of the system builders. Are they similar? Are they comparable? Absolutely, it's a very important area, and we hope that we can develop that further within our dynamic coalition, the study of that. Absolutely, I think it would be a very good topic. So again, audience, sorry, Jan, go ahead.
Looking at both system, blockchain and AI, I think they have a quite different approach. Blockchain is made to be trustworthy. So if you have a system that is most trustworthy, it's blockchain, because it's secured, it's transparent, and you can have more trust because it's distributed, decentralized, and it is almost impossible for a single actor to manipulate it. AI is completely different. It's not trustworthy. And of course, if a system works well, if a system saves your life, you don't care if it's trustworthy. You use it.
Yeah.
And if a system is able to detect a cancer that would not have been detected by a human, of course you trust it.
Yeah.
And you don't care whether you don't understand it. And it's not, it cannot be understood as a reasoning. Of course you can understand how in general terms it works, but this does not give you an answer. It's like, well, if you go to court, I can explain to you how courts in general work. But this does not explain the decision to you. You want to have the reasoning, and even if the reasoning is not understandable to you because you're not a lawyer, then you can see a lawyer and you can ask a lawyer, is this correct? They can verify it. So this is the reason why we really need transparency. If you just tell people, I give you some wishy-washy explanation that explains to you that the general basics, it's not transparency, because it does not explain their decision, how it will work for them. And if you just have some general explanation, and a lot of people in this domain are going for those kind of general explanation and think they are providing transparency because the other is not possible. But you have to be clear that it's not just because there is some proprietary information there and companies don't want to expose it. They don't have it. They if you really dig into it, you will discover that those rules, of course they are there, they're very complicated and they're pretty stupid, but they're combined in a way that they make sense. But they have gaps, and they have a lot of gaps, and in those gaps they fail. And you would never build a system like this. And it's not the system builders that decide on those rules. It's the system. It's the dice. They're rolling the dice, and that's the reason why those systems are not comprehensible.
Yes, exactly. Yes, I'm very glad you brought up the transparency with the topic, algorithm transparency, right? Yes, exactly. Thank you, John. I also want to add that, we are also seeing newer technologies coming in. I came across hologram technologies and all these brain scans and how they're developing these images of patients' brains and so forth. So I think we're going to see a lot of development on top of these technologies that we are already talking about. And as Galia mentions about ethics and privacy, these are going to be very new areas for us in terms of ethics and privacy in these hologram areas as well as dealing with AI, machine learning, and blockchain and so forth, and the mobile technology, and how all the service providers of mobile technology deal with this and across jurisdictions and all these kinds of things. So we have a number of issues to talk about. And I'm just wondering, audience, again, I have not been really following the chat. Is there anyone else, please, who would like to ask a question of our speakers? Please. Okay, someone has asked us how they can get in contact with us. Please go to the IGF website under the section of Dynamic Coalitions. We have our email address, and please join our list, and you can join us there. Also, if you want to contact me personally, you can just look at my profile meeting, the IGF meeting, and you find a LinkedIn, and in the LinkedIn there is an email address. Very simply, I'll say it over here. It's amalidesilva@yahoo.com. Okay. Now I'm just, this is, I am not very familiar with dealing with this, so bear with me here if I'm trying to pick up any other questions. Otherwise, let me take a quick look here. Someone has asked about heavy files. Galia, please, could you respond to that, please? It says, Galia, about heavy files, can they be accessed in a more efficient way thanks to blockchain? Galia?
Okay, yes, thank you. Yes, thanks for this question to Palin. I have just answered it also via chat. I have mentioned to her about the so-called self-sovereign identity concept, through which you can disclose only special attributes, and in case these are health data or large files that include some x-rays or whatever other health information you are in possession of, I think the self-sovereign identity concept is a very good concept in which individuals could disclose and share certain attributes or certain information about themselves. I also, yeah.
Please go ahead. Yeah.
I also wanted to actually also comment on the remark of Jorn about the trustworthiness of the technology. I would completely agree that trustworthiness is the key point in using technology. And here we have now robots that are conducting surgeries, right? And I also ask myself, like, if I trust this roboter, and if I go to such a surgery, and in case something goes wrong in this surgery, which of course nobody hopes for, who bears the responsibility, right? So I think here is an interesting case when you have trustiness, right, trustworthiness and ethics, and maybe some legal aspects, which come into the big picture.
Absolutely, a very, very interesting area. Absolutely, yes. And especially, I think when we have these new technologies, and as Jorn was saying, in terms of, I guess, the time it takes for the technology gets sophisticated, there is room for error. Yes, exactly, absolutely. Now, Jorn, would you be expanding a little further? There's another question from Palin about asking about the trust of users.
I try to answer it. It depends whether of course, well, trust does not really always depend on transparency. It also depends on experience. So if we have a good experience with a system, we might trust it even we don't understand why it is doing that. When you look at self-driving cars and look at humans driving, you might have a human that is driving much better than the average person. And this human might still cause an accident. And this person then cannot tell you, but I'm driving much better than the average person, and therefore I don't want to be liable for the accident. Of course, the person is liable. And if you develop a self-driving car that is driving better than the average person, we are not there yet. But if you arrive there, why should there be an exclusion of responsibility just because the self-driving car is driving better than the average person? Humans are not excluded from responsibility there. So if you go to hospitals, then to surgery, if you have a robot that performs operations and that is having higher success rates than humans, then you still have to ask, was this an error or was it unavoidable? And if there was an error, then you should look for product liability. And you should not say, well, this is better than average, so you should not be compensated for your loss. You should apply the same standards, and even the highly skilled doctor that is better than the average doctor by a factor of 10 or whatever, if they do an error, and they do commit errors, they are still liable, and there's no reason to exclude them. And we have to make sure that we apply the same standards. And of course, the manufacturer cannot pay. The doctor cannot pay either. They require insurance, and the insurance.
Yes.
And this is how we deal with it with humans. And why should we deal with it differently with computer systems and companies doing it?
Very good points. Very good points. Yes, exactly. It's going to be a very interesting area, as you mentioned, for all these insurance companies as well, and how they insure all these technologies. It's a whole new area there too, which I'm sure we need actually to get some people on board who are familiar with the insurance background there onto our dynamic coalition. So anyway, I think we are coming to the end of our session time. And I really appreciate the audience who joined us in this conversation. We would really love you to join our mailing list. We also are going to have a social network session on the 6th at 1600 hours UTC. So please join us there. Very informally, we will either talk further on values that are important to you, or otherwise just to social network and get to know each other and so forth. So please think of joining us at that event as well. So I'm just going to ask the speakers, do you have a minute? Would you like to say something else? Galia, Herman, Hyun, before we wrap up?
Who wants to go first?
Yeah, I can also mention words. I think that we just scratched upon these big issues in the future: insurance and e-health, technology, trust, ethics. And I think that these are just starting discussion points for our dynamic coalition. And I look forward to the discussions.
Thank you.
There's little Herman? I could. Sorry.
Okay. Last remarks. I just want to say that all the topics that were presented today are important, and we just have to look at the health system in other way, because there is a revolution coming up. The internet and the ECTs are bringing a revolution to the health system. So it's important to pay to pay attention to health system. Thank you.
Absolutely. Thank you. Thank you.
Well, I think there is some space to use technology, especially in the context of COVID, and we might really need to use advanced technology when we look at about tracing. This can help very much in containing the virus. But we have to be careful at the same time. We need to be watching what we are doing. The numbers of COVID are exploding, and you can see it. You don't need AI to see that. And it always was visible, and the information was there. We usually don't have a lack of information. We have a lack of selection criteria, which information we should take and should believe, and after which scientists we should follow. Because even the scientists, of course, they don't always agree, and there is a lot of discussion. So usually there's not a lack of knowledge, but a lack of knowledge. What knowledge is good knowledge. So
very good point.
It can. Well, I think there's a big potential, and I'm looking forward to this discussion in our group.
Thank you. Thank you. So I think this concludes our event. Thank you very much to our technology hosts as well there in the background in facilitating this session for all of us. And thank you very much to our speakers, and thank you very much for our audience for joining us. And hopefully we see all of you on the 6th for some further conversation. So thank you.
Thank you. Bye.
Bye-bye.
Thanks. Bye.
Thank you.